Now, preseptal cellulitis is infection of the soft tissue anterior to the orbital septum, and orbital cellulitis is an infection posterior to that septum. Preseptal cellulitis is generally considered a more mild condition that doesn't lead to any serious complications for the most part, whereas orbital cellulitis can be much more severe and can lead to a loss of vision if not promptly treated. Causative agents in the pediatric population include things like Staphylococcus, Streptococcus, and Haemophilus influenzae. And in patients over the ages of 15 or so, they're much more likely to have a polymicrobial cause. And if they're immunocompromised or have conditions like diabetes, then we may even think of a fungal cause as well. And in those patients, we're going to see more significant symptoms such as severe cellulitis, proptosis, and sudden vision loss. And obviously these patients should be having an urgent referral to an ophthalmologist. Now, in preseptal cellulitis, we know that these infections commonly come from the surrounding tissues. And so we're maybe thinking of things like sinusitis or upper respiratory infections that are commonly associated with preseptal cellulitis. Both conditions are diagnosed clinically, and in both cases you're going to see eyelid swelling with or without erythema. However, in orbital cellulitis, symptoms may be a little more dramatic. So in addition to erythema, you may find deep eye pain with movement, vision changes such as diplopia or blurred vision, and fever and or leukocytosis. And again, these diagnoses may be made clinically. However, in all patients with suspected orbital cellulitis should receive a CT scan with contrast of the orbis and perinasal sinuses to evaluate for associated sinusitis and other possible radiographic findings. And now a specimen sample from any drainage that we may see may be cultured with sensitivity to determine our best treatment options. Now, if bacteremia is suspected, we may want to also obtain a blood culture as well. Treatment with antibiotics is usually empiric or based off of the most commonly infecting organisms, and appropriate oral therapy for preseptal cellulitis includes broad-spectrum antibiotics such as third-generation cephalosporins like ceftonir or things like amoxicillin clavulanate. Now, if MRSA is the suspected culprit, then clindamycin or doxycycline may be more effective for this. And if all of this is associated with sinusitis, then we may also consider a nasal decongestant such as oxymetazoline and follow up within 24 hours for these. Now, in patients with suspected orbital cellulitis or in those who don't respond to oral antibiotics, we should refer them to an ophthalmologist for hospitalization, urgent imaging, and IV antibiotics.